I can get on, then I'll at least, I can't even get to my email and my contact base, so it's a bit of a pain. What can you do? You do what you got to do, right?
That's right.
So Jim Cameron, sorry to hear about your back surgery. That's not good.
Yeah, well, it's something I had to get done. It's been nagging me for well over a year and a half, and it was getting worse and worse, and really just getting me down.
Okay. And what did they do?
They went in and so I have spinal stenosis and I have 5 herniated discs, and they went in and fixed them.
Oh, that's good. So they just cleaned them out. They didn't have to do major surgery if you're home already, obviously.
Oh, well, they had to drill holes in my spine for the nerves to pass, so
wow.
They wouldn't hit.
Okay. Wow. You demand.
They didn't have to put any hardware in or anything like that.
Okay. Okay. Well, I'm looking to see if I've got an internet connection back. So, Jake, who do we have on the call today?
Okay, we have Dennis Correa, Eric Bookbinder, Jim Cameron, Len Sierra, you and me, and 2 callers on the telephone who I don't know who they are yet.
Okay, we'll find out in a minute. Dennis, I'm in 2 back.
Right here, I see. Great.
I'm
Jim Harrington on the phone.
Okay, hi Jim.
Hi, Jim.
Hi, how are you?
Mike Tamales on the phone.
Mike Tamales. Hey, Mike Tamales.
Hey, Rick.
Oh, it's a little hotter here than it is in Hawaii, I think. But it's not too bad.
Let me switch phones. It's probably
not too bad. So Dennis, I got down here yesterday. The place is great, but I'm leaving Wednesday to go back north again. But I won't be down here full time until June. But we'll get together pretty soon. I feel great being down here again, so I'm happy.
We were all wondering why you had moved from California to Arizona.
Because I couldn't find anywhere. My landlady raised my rent $700 a month, and I couldn't find anywhere from Ukiah to San Diego where the price was right.
Right.
And my property I own is here in Tucson.
Oh,
so
okay.
It just seemed to make more sense to come down here, and where the cost of living better matches the rents that I collect. So
Yeah, sure. Okay.
that's the problem. So yeah, Dennis, it's great. I'm right off of I-19.
Oh, good.
I'm about a mile north of Tubac. I'm about a mile north of the post office and the little Tubac center, which I haven't been to for years and years. But that's where I am. So it's great.
Oh, good. Good. We should get together maybe Tuesday. I don't know if you're going to be too busy to get together before you come back in June. Or?
Well, here's my schedule, and I'm going to try and keep. I mean, this applies for everybody, so I'm going to try and get to all the meetings and hold all the meetings. But Wednesday, I'm leaving here to go back through California to hopefully buy a car. And then I have to go back to San Francisco, close out my old apartment, and then I have a trip booked to England, which I've had for a long time, for 3 weeks, from May 15th to June 6th. And then when I come back on June 6th, I fly back into Oakland, and I'll probably be there 2 or 3 days or 4 days, and then I'll come back down here again. And then when I get back down here in mid-June, around June 10th to 14th, sometime around then, I'll be here permanently at that point. So the only time I really have is tomorrow, and I don't think I'm not sure it's going to work because I'm at someone's mercy. I've got to get a ride up to the airport to rent a car. I have my old Triumph. We came down in a U-Haul, in a 15-foot U-Haul that was packed to the gills, and we towed my old Triumph behind it. So the Triumph is fine, you know. It gets me around, but I don't like to use it too much, and I have to pick up a rental car to drive from here back to California on Wednesday. So I think tomorrow might be a little aggressive for me.
Okay.
Schedule.
Okay. Well, I'll wait till you get back in June and you got more time.
Now, if you want to come down here and help me unpack boxes, you could always do that. Just kidding, Dennis.
Okay.
So anyway, that's my story. So, Jake, you're going to have to, or Len, one of you, whoever can see, because I don't know, I still can't get on. I'm going to try and get on to go-to meeting. You know, the funny thing is, guys, that you curse out Comcast and Xfinity for years and years, and then I come down here and it's a little 2-bit mom-and-pop shop that supplies the internet, and I've been trying to leave them a message since Saturday morning when I was still up in California, and their messages are full. So I can't even get hold of the internet company. So, you know, you go from the sublime to the ridiculous here.
What's the name of the town, Rick?
The name of the town is Tubac, Tubac.
Yeah, I see it on the map.
Okay. And the name of the internet company is Sprocket Communications. And if any of you know Mr. or Mrs. Sprocket, you could bend it. You could bend one of their sprockets for me if you would. Because it's very frustrating when you know. There's a satellite on the roof, and it's all connected. Everything's connected up. I just got to get hold of them to tell them to turn it on and find out how much they're going to fleece me for.
Wasn't that who George Jetson worked for, Sprockets?
Probably. That's probably why they called it that. You know, that's probably exactly the reason they called it that. Who, Len or Jake, one of you guys, is Peter on the line yet?
Yep, Peter.
Yes,
Peter.
he's on.
Peter joined us.
I'm
Bill
on.
Franklin.
Peter.
Bill Franklin is
Okay.
here.
So Peter,
Yeah.
would you be kind enough to do a roll call and let me know? In the meantime, I'm going to try and get on at least so I can see who's on the call. I don't think I have enough bandwidth to conduct the call, so I'll stay on the telephone. But
Okay.
can you go ahead and thanks?
And I'll fill in the names.
Jake, myself, Bill Franklin, Dennis, Eric Bookbinder, Jim Canham, Jim Harrington, Len, Mike Tamales, and yourself, Rick. And I've got 2 callers on the phone. Do you want to identify yourselves? If you speak up, we can figure out who you are.
Yeah, hi, this is Dan, San Francisco.
Stanley,
Hi.
You surfaced.
All from the
Oh,
different
what?
depths.
From the depths. Where have you been?
Well,
Tell
buzzing
us.
along in life.
You will tell us. You will tell us in good time. So thanks. That's great to hear your voice. I'm really pleased to hear your voice, Dan. I was getting worried, and I've just been so busy the last 4 to 6 weeks since I found out that I had to move. But you've been on my mind, and I'm delighted to hear your voice. Who else is who's the other? Is there one other person who's calling in? Would you like to identify, or if you're not comfortable, that's okay too. Okay. So feel free at any time to jump in and tell us who you are, or if you just prefer to audit, that's fine. And you can always audit. You can come in another time and tell us who you are. However is best for you. But you'll get the hang of what we do here pretty quickly, and I think last week we had Greg Harrison, who started with us, who started auditing and came in after about 20 minutes, and we had a really good conversation with him. So the good news is that I shouldn't say good news, but we don't have any new callers on the phone. So we'll actually give us plenty of time. I'm going to do my best. I'm going to try and join right now, so you may see me up twice on there, and we'll see if it comes up. At least that way I can see who's speaking and stuff. And did somebody else just join us? I heard a ding, ding.
Tom Van Zant's on the final line.
Yep.
Oh, Tom Van Zant.
Hi, Tom.
Hello, Tom Van Zant.
How you doing? How you doing?
Most of you, and so obviously there's no video of me today, but that won't disappoint too many of you. And those who it does, I'd be happy to sign and send you an autographed picture. Okay, so let's start going down, and let's see who's here, let's see who's got stuff to talk about. Yes.
Can you hear me?
I can hear you. Who's that?
Hey, this is Bill Franklin. My audio, my mic was not working, but now apparently it is. So.
Okay. Now we can hear you. So you'll forgive me if I don't. I'm doing this. I'm working today purely on voice recognition, so I may miss a little bit. Although it's good because my GoToMeeting screen just came up. So I'm going to mute myself as soon as I can. Or Jake, would you mute me on the? Would you be good enough to mute me on the GoToMeeting?
The phone version? Yeah.
Not the phone, on the meeting, on the web.
Oh.
You'd mute me.
Okay.
Okay. Thanks. So here we go. Let's go down and oh, there's Eric. Oh, I may have to cut this off. We'll see how this goes.
Yeah, I can't mute you anyway, Rick, for some reason.
Okay, I'll mute myself. As soon as I can, I will mute myself.
I've got you muted.
He didn't want you to mute his phone.
I did mute his phone.
No, he doesn't want you to do that. I'm muting.
Okay.
I got it. Never mind, I got it.
So now you can hear me. Yeah, don't mute my phone. Just mute the web if you would, please, because my access on the web is so spotty that you're going to hear me and then you're going to lose me, I think. So I'm going to stay on the phone. Jake, and you'll record. It's my turn to say this. Are you recording, Jake?
Yep, I am.
I love to say. I love that. I love to say that.
First time in a long time.
Yeah.
Yep, I got it.
So, Jake, you had something last week that we didn't get to. So, if you remember what it was, I'm going to put you in to talk to us.
Oh, okay. It was just a brief comment.
All right. Well, brief or not brief, you still should have some time. Jim Cannon, anything you'd like to tell us? You could tell us a little bit about your back surgery. It would make a nice change.
Yeah, well, I'm going to hang on as long as I can tonight. I probably won't make the full 2 hours, but I'll do what I can.
Okay, we'll put you up early. We'll boost you up to the top in case you need to take a break. Len, how about you? Len, how about you?
Yeah, I had a quick question I'd like to ask the group.
Okay, that's fine. Dennis, anything for you?
No, nothing new for me at this point.
Okay. Eric, I think you should. I'm looking at you, but you can't see me this time. I'm sorry. Eric, I think you should probably fill the guys in on what's going on and where you're going on Wednesday. And is that okay by you?
Yeah, that's fine.
Great. Jim Harrington.
Hi,
We need
Rick.
an update. Hiya. We need an update from you on your trial. Yeah, on your.
Okay, just take about a minute. I'll be happy to do it.
Thanks. Your Listeria trial. Mike
Yeah,
Tamales. Mike Tamales. We would love to hear what's going on with you. Maybe you and Peter between you can fill us in a little bit.
Okay.
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 Bill Franklin, how about you? Anything for you today?
Yeah, I'll have a question for the group.
Okay, and let me just digress, guys. Just bear with me a second whilst I got Bill Franklin. But how are we doing with Rich? I sent him details of 2 or 3 surgeons in Tokyo.
Yeah, I saw those.
Okay.
Yeah, I have not heard back from him in the last few days. We usually just correspond via email.
Okay.
He called me,
given,
so I missed a call from him too. So we'll get back together.
But given my travels today, this week, if you could just be good enough to just follow through with him, that would be great, and just let me know if he needs anything else.
Yep.
But we're working on those names. We've got him some good names in Florida and in Tokyo, which is what we said we would do.
Well, I
Dan
sent him the
Louie.
information.
Yeah, hi. Got a couple of questions, or maybe share some thoughts, experiences.
Absolutely.
That can help me. So.
Absolutely. And Tom Van Zandt, anything for you today?
I'm doing pretty well. I'm doing so well that I had to go to another person's funeral, and a cousin told me that I looked very, very good for a dying man.
I think if they gave Webby Awards, Webby Awards are those things they give for people that do things on the internet and conduct meetings on the internet. If they gave Webby Awards for black humor, I think we'd be a shoo-in, don't you? Does everybody agree?
And you're missing it, Rick. The mustache is showing up tonight.
Oh, is it? Well,
It is.
I'm getting a horrible picture. Unfortunately, I can't close off the video coming in, so that takes up bandwidth as well. But listen, I'm happy. At least I can see, from time to time, I can see who's speaking and stuff. So, and has anybody else joined? Let me go through the names, run through the names, and then I have a few more things, so maybe some other people have joined us. Jake Hannum, Jim Cameron, Lynn Sierra, Dennis Correa, Eric Bookbinder, Jim Harrington, Mike Tamales, Bill Franklin, Dan Louie, and Tom Van Zandt. Anyone else on the line that whose name I haven't called out?
Yeah, I'm on. Peter's on, and also Larry Fish is on.
Oh, Peter, I'm sorry, Peter, I meant to call you. And Larry Fish is on, okay? Peter, anything for you that you'd like to talk about?
I just have a very quick, short question for Dan Louie.
Okay.
Okay. And Larry Fish, anything for you today?
Right now, nothing specific.
Okay. All right. So I think I've covered everybody. If I haven't, yell out or put something in the chat box, because hopefully I'll be able to see that. And we'll get started. And we'll get started with Jim Cameron, who may want to take a nap before the end of the call. So, Jim, tell us what's going on with you and how you're feeling and how quickly you're going to be playing golf.
Well, for the last eight or 9 weeks, I've been going through the oxygen therapy, and I've completed 31 of 40 treatments so far. I get 32 tomorrow morning. And I've been dealing with this back issue for better than 18 months. And I finally said I got to do something about it. So last month I went back to the surgeon that I chose, and I scheduled it, and I got it done Friday. I got it done Friday morning. 3 lapidectomies to take care of the herniated disc and the spinal stenosis. feel pretty
All
good
right.
considering it's only Monday, and I was operated on Friday, and I came home Saturday. It's a little sore. That's, I guess, to be expected.
How many inches taller are you?
I don't think I may be shorter.
I know people that have this stenosis stuff, and they finish up gaining 2 or 3 inches, man.
They didn't say anything to that about me. That basically the stenosis is a form of arthritis, and I've had rheumatoid arthritis for 40 years.
Right.
From the MRIs, you can see where the nerve in 3 spots is touching the spine, and that's where they had to go in and drill holes in the spine to free up space for the nerves to flow.
Right. Tell us, Jim, about your hyperbaric chamber treatment. First of all,
I've done 31 of 40.
Wait, hold on a second. Just tell the guys why you're doing it and what it is, because there may be some people on the line that aren't familiar with what we're talking about here.
Okay, I'm doing the therapy because I was having some incontinence, and after going to the urologist and all, they discovered that half my bladder was burned 12 years ago at Sloan Kettering when I had radiation for the prostate. And they said that's common, that it doesn't act up for about 10 years. I started to have a little bleeding, then I started to have a lot of bleeding, and with clots coming out and all. So I decided they gave me the options, and they said it'll only get worse. So I'm sorry.
No, go ahead.
They gave me the option, and it was a big decision because you're committing a lot of time. You know, it's 2 hours every day for 40 days in the chamber. But really, it turns into, by the time you get there, go through all the rigmarole and everything, and get out of there, it's 3.5 to 4 hours a day for 40 consecutive days. So that's 10 weeks. That you're tying up, 1/2 day the whole time.
Right.
I've done 31 of them I did one this morning. I did 31 this morning. Because all you do, you lay in a hospital bed in this sealed tank for 2 hours. And you sleep, you can watch television, but that's about all you can do because you can't bring anything in the tube with you. And I would say 4 weeks ago, I stopped bleeding. So I'm very encouraged with that. I mean, when I'm all done in a week from next Friday, I'm sure they're going to schedule to go back in and take a look at my bladder and see, if the burn is cured, because the oxygen is supposed to cure the burn spots in there and get rid of the dead cells and regenerate new cells.
Excellent. Now, Jim Harrington, is this a treatment that you're at all familiar with?
Yeah, I do know about it. Actually, my former wife worked at hyperbaric, and in California, when we lived out in the LA area, and it was near the ocean, and a lot of it is used for divers and so forth. But I never heard of this treatment being used for prostate cancer. And I know, Jim, that you're trying it. I think it's great, but I do not. I mean, I know what it is. I've seen the chambers. Really, they're called chambers, not tubes so much. But these stay under high pressure oxygen, and it can certainly good for divers, cures the bends and so forth. But I can't help you, Rick. I really don't. I never heard of this, and so I wish you the best, Jim. And are you coming back to New Jersey? Or are you?
Well, I gotta wait probably 5 or 6 weeks till the back surgeon releases me. I probably won't be back until till middle of June.
Okay. Sorry, and that's all I can help you with. I don't know anymore.
I'll just add a little something. There are some other people there that have the same problem I do, the burn from radiation. But a vast majority of the people there are there for diabetes burns. On the legs. to regenerate the skin on their legs. There's quite a few of those people there.
Mm. So the concept, the idea is that this hyperbaric treatment, which is oxygenating the organs or whatever is being focused on.
Actually, it does your whole body.
Right.
You're inhaling 100% oxygen for 2 hours.
Right. So, and the idea is that it stimulates the growth, stimulates the cells to grow again,
regenerate themselves,
and to regenerate.
It regrows the tissue that's destroyed.
I see. Excellent.
When they first told me about this, I had never heard of it either, and I checked with 3 different centers. I was surprised how many centers there are. In Florida, there must be 40, and up in New Jersey, because I was thinking about waiting till I got back to New Jersey, there's about 20 centers in New Jersey. And I talked to 3 different centers, and they all told me that they routinely have prostate cancer patients in there that had their bladders burned through radiation.
Well, look, it's really good to know about it because we've had many men who have, from time to time, attended this call who have this issue of severe radiation cystitis. And if it seems to work for you, then it's certainly something that we can tell them to check into. And you, my man, Mr. Cameron, are going to be the hyperbaric chamber expert.
Yeah. Well, and I'll tell you, the worst part of it is that when you first commit to it, you're committing for 5 days a week for 10 weeks, or 8 weeks rather, of going every day. To me, that was the hard part, making that commitment. But going, it's not painful.
Are there any side effects?
The only side effects I've had so far is a little fatigue, but I get fatigue from my arthritis medication, my cancer medication, and the painkillers they were giving me for my back. But the fatigue's not overwhelming.
And do you think that's from the treatment, or do you think it's from other things? I mean, do other patients there complain of fatigue as well?
That's the number one complaint they tell me that they have, fatigue.
Okay.
But generally speaking, most of the people who are there for diabetes are in their 70s and 80s.
Yeah.
There doesn't seem to be a lot of young people getting this treatment. Most of the people seem to be, well into Medicare.
So
and Medicare does pay for it.
So let me throw it open and see if anybody on this call has got any questions for you about the treatment. Anybody like to talk to Jim Cameron about this treatment? And
yeah, I have a question. This is Jake, Jim. I'm just curious.
Okay, Jake.
How you doing? You mentioned a tube. Is it like an MRI tube, or is it?
Yeah, it's very much like an MRI tube, except it's clear.
Okay.
And you're laying in what seems to be like a hospital bed that's on rollers. They roll you into the tube and into the chamber, or I call it a tube, but it's like an MRI tube, only clear.
Okay.
And on top of the tube, they have a small video screen, and you can watch television, or you bring movie. You can watch a movie.
Oh, okay. Do you have any sensation?
Once you go in it, they take you down to 60 feet of pressure, and if you need to get out, it takes 10 minutes to bring you up, or you'll suffer the bends.
That was my next question. I was wondering do you feel anything when they change the pressure?
You do a little bit on your ears. Like the only the side effect my wife's noticed the most is I'm a little harder of hearing, because it's like being on a long plane ride. When you get off, your ears are popping.
Yep.
And I'm doing this every day, so it doesn't really recover. But they do have a specialist there to check my ears, and when I get there, and they check them when I come out out of the chamber.
I'm guessing maybe they're worried about punctured eardrums, perhaps.
To be honest with you, I don't know what they're worried about, but they're real conscious of checking your ears coming and going.
Jim, this is Peter. You
Hi,
mentioned,
Peter.
You mentioned this was a side effect of radiation at MSK 12 years ago.
Correct.
Do you know if they've addressed this in modern day now, radiation to somehow protect the bladder from this kind of stuff?
Okay, here's what I was told, that back when I had the radiation done, you went in with an empty bladder, so your bladder sits down on top of your prostate. Now they want your bladder filled so it expands, so most of the bladder is away from the prostate. That's what I was told.
Right, that's what they do. That's interesting. Good. So the radiation machine hasn't changed. It's just the format of filling the bladder has changed.
Correct.
The radiation machines have changed a little bit.
Yeah. Well, I know when before I started the treatment, when I was up at Johns Hopkins, Michael Carlucci, my doctor up there, told me he sees this frequently, where people who had radiation in the time frame that I had it have this problem. But the crazy thing, which I had a little bit of
radiation cystitis, but it was never that bad. It never clots. But we've had guys even who recently got radiation who have had issues with clotting. Fortunately, I can't get to my my database right now, but I think, if I remember correctly, Ron Shaheen had a problem with this a year or 2 years ago, a year and a half ago. So while I'm sure that by and large, by keeping the bladder completely full, it helps, I don't think that we have eliminated that problem. And I know back in 2007, they never made an issue of me going in with filling my bladder.
I had my radiation in 2005 and 2006.
Right. I think I was probably right on the cusp where they were moving to having people fill their bladder, because I remember at the time some people said they had to go in and fill their bladder. It now seems to be quite a common thing.
Everybody I talked to, one thing I couldn't understand was that, if they burned my bladder 10, 12 years ago, how come it took 10, 11 years for it to start bleeding? And they told me that's common. They said that happens all the time.
Yeah, it is common.
I got that from 3 or 4 different doctors.
Yeah, it is common because radiation damage takes an awful long time to have an effect, and then it tends to get worse as time goes on. So.
Well, so anyway, guys, for the few weeks that I
move on.
Let me just, before you move on, this is Bill Burhans. So
yes, Bill. Hi, Bill.
I'm one of the ones that has this problem, and I went through radiation much more recently, about 3.5 years ago, and I did, the protocol when I went through radiation treatment was to fill your bladder before each treatment. So, and yet it didn't work completely for me. It became a fairly, radiation cystitis has been a fairly significant problem.
Well, Bill, I don't know if you heard Jim Cameron earlier on when he started talking about this, but he says that after about 4 weeks of treatment, he's still in treatment. He's still got another 10 treatments to do, 2 weeks worth. But after about 4 weeks that his bleeding ceased. So, maybe this, I don't know if it's anything that you need it right now, if it's anything you've looked at, but it might be worth looking into this hyperbaric chamber treatment protocol.
Right. That's something that I discussed several times with various doctors, and I decided in the end not to go through with it because, according to one of the doctors that I trust the most, the evidence that it would really help wasn't all that great for someone like me. I mean, that's, I think that's specific for my situation. And now I can't do it because I now have a intrathecal pain pump installed as of last week, and so that precludes any possibility of going forward with it. But I have heard of other patients who have benefited greatly from hyperbaric oxygen treatment. So, I think if I had been, if my situation had been somewhat different, I probably would have gone through with it earlier.
Okay.
Having gone through 3/4 of it already, the hardest part is the time you're allocating for it. That's,
I want to move along because there's a few people want to speak. We can always come back to this later, and we need to check in with Bill too and see how he's doing after his surgery and his new pain pump, because that's another interesting topic that I'm sure some of you will want to learn about. So I just want to keep this moving. Jake, you had a quick question that you didn't get to last week.
It wasn't really a question. I was just going to give you an update on my status of my Xtandi.
Oh, please. Absolutely. Please do.
My PSA on being on Lupron for close to 5 years, and Zometa and bicalutamide, they all stopped working, and my PSA had risen to 15.5. So my doctor put me on Xtandi about 4 months ago, and it's dropped now. Went 15.5 to 3.3 to 1, and now 0.7. So I'm happy with that.
That's awesome, Jake.
Yeah, I'm very pleased. I think unfortunately, I think it's sensitized me to foods and things that and it's actually, I think, has made me allergic to some foods that I was never allergic to before. I can't prove it, and I can't find any literature on that, but that's the only thing I can think of. Suddenly, the other day, I ate a pear and I broke out in a rash. I've been eating pears for 63 years.
Oh, gee.
Yeah. So.
And I would say, Jake, you would have to agree that there's nothing like a nice pear, right?
Yeah. Well,
I know. Nothing like a nice pear. That's what I always say.
Since I've been on Lupron, my nice pear has gone away.
Oh, okay.
So that was just, I just had a comment.
That's interesting. I mean, no, that is interesting because I've actually never heard of anyone else talking about food allergies, but it's part, and you're not taking any other new drugs? That's the only new drug you're taking?
Nope.
The enzalutamide?
Yep. Okay. And it all started about a month and a half, 2 months after I had been on it, and that's the only thing I could think of. My doctor said I was an allergist, but.
Anybody else have any issues from enzalutamide with food, regarding food, who's taking it? Okay. Well,
and the only other thing, Rick, is I've also noticed lately that I've been having some urinary issues. It's never been great since I had prostate cancer, but now my bladder seems to fill up very quickly, and yet very little comes out. And I don't know if that's the cancer returning or that's a side effect of the Xtandi. I don't quite know what's going on with that. I'll have to ask my urologist when I see her next time.
Well, a couple of things. I mean, I think first of all that it's possible that the way that with the cancer that there could be growths that are obstructing, and I think you need to find that out. It's really important because the last thing you need is a full obstruction, because apart from anything else, it's incredibly painful. So you definitely need to work on that a little bit. I definitely also urge you to review it with your doc, both the medical oncologist who you see, but you may also want to talk to a urologist about that.
Right.
Because I think there's two possible issues going on. One is that it might be related to the cancer, in which case the medical oncologist, I know she's not a specialized GU medical oncologist, but after she's been working with you 5 years, she probably could call herself a specialized GU medical oncologist.
Right.
Because she's been through all of the issues with you. But having said that, she may want to do some screening to see what they can see there. But the other thing is that there may be other issues that might be lesser related to the cancer, which is really more of a urologist field. Do you have a urologist or not?
Yeah, I do. I had to see a urologist every 3 months because I had bladder cancer a year ago. So she does a cysto every 3 months, and she did tell me that, you know, that my bladder looked like, or my prostate looks like it had gotten larger. So.
Well, that may have something to do with it. I mean, that's sort of strange because usually the hormone therapy shrinks it.
Yeah, right.
But you know, my feeling is that well, me, I'd be asking the urologist to talk to the medical oncologist and for the two of them to work together.
Okay. Yeah, I have appointments in May and June with both of them, so I'll do that. Yeah, and theoretically, I should only have half a prostate, so it should be smaller than the average guy, since I had mine frozen 7 years ago.
Well, that's right. But Jake, what I'm saying is, don't wait on this. Don't just wait until May or June, because you know the last thing you need is to wake up one day and then you can't pee and you're in all kinds of pain. This is something that you've got to pay attention to.
Okay.
And, you know, tomorrow or the next day, call them both and say, look, I'm having these issues. I know I've got appointments coming up, but I want to talk to you about it. I need to get in to see you about it quicker because I don't want this to get worse and then I've got side effects. Again, I'm going to throw it out, and anybody want to contribute on this?
Yeah, Rick, this is Jim Harrington. I've been through some of this, but be careful of this. Be careful you don't have urethral strictures or scar tissue building up in urethra. And what I suggest the urologist can do is do a cystoscopy, which is just stick a scope up your penis and take a look. I had them, and I had some scar tissue in there, and it can be removed. It's not a big deal, but just make sure it's not somewhere in there. And why scar tissue forms, I don't really know. My urologist said once scar tissue, always scar tissue, but a cystoscope, they just go on up and you can see it yourself. And if you do have some strictures or some closed points, then they can clear those out. It's a minor operation, but I sure had that problem. I was thinking, my God, what if this thing closed up? What the hell am I going to do? I don't know if that would happen. Well, Jim, it's something to be mindful of.
Jim, I do. I have a cystoscopy every 3 months.
Oh, you do? So they do look. Okay, well, then it may be, like you say, your prostate and that, but I would just sharing one of the problems I had, and my urologist fixed it.
Okay.
But that's good.
She did offer me some medicine. She offered me Mirbetric, the one they advertise on TV all the time, which I know is going to cost $85,000.
Mybetriq, I take it. I don't pay $85,000. And you know, Mybetriq is basically, it's for a weak bladder, for a active bladder or whatever. And I don't find it works all that well. But I must say the reason, it is an expensive drug. It's a new drug.
Right.
But honestly, if I count the number of times I pee at night, I don't know if it makes that much difference about taking that pill once a day or how much I drink during the day. But I do take Mybetriq, and I don't know, honestly. If I had to pay for this stuff, I probably wouldn't take it. But my bills for pharmaceuticals are huge. So I wish you well with that one. It doesn't. There are other overactive bladder drugs, but this is a new one, supposed to be better. I've tried both of them, whatever the old one is, and I swear I don't see much different to it. But all power to you.
Okay,
if
well,
it works to you, I don't know where this $85,000 business. It's not that expensive.
I was just being facetious, but I knew that because they advertise it on TV all the time, it has to be expensive.
Right.
Yeah, it's new and it's more expensive. Not that expensive, honest to Pete. You know, I mean.
Well, right.
Gents, Mybetriq is spelled Mybetriq.
Right.
It's a drug we've talked about on here before, and as Jim said, it's a very current, up-to-date treatment for helping you pee.
Overactive bladder.
Traditional overactive bladder, to stop to prevent urgency. I'm trying to remember.
Yeah, I can't remember it either, Rick, but it's been around forever. This is just new on the scene, and I took them both, and I don't see much difference to taking. I take Mybetriq every day. I have a lot of it. I got bottles of this stuff. I know it sounds crazy, but I also don't pay for these drugs, so I should say that. But I take it anyway. I've got to go back to my urologist and see. I think I could just as well stop it, but maybe if I pee 5 times a night or 6, maybe I would pee 8 without it. I don't know.
Okay.
Hard to say.
So, again, I want to move this along because I'm just keeping an eye on the clock, and we can always come back here. But Jake, other than the issues that you've raised, the allergy and the urinary issues, is there anything else you'd like to bring us up to date on?
No. I'm like I said, I'm pleased as punch with the 0.7. And I'm willing to put up with a lot just to keep the PSA low. So no, that's all for me.
We're all delighted that you're responding so well to the enzalutamide. And go with your medical suggestion to see an allergist and see if you can nail what's going on. I mean, it sounds a little weird, but
it does. I'm trying to rule things out. I'm stopping this and I'm stopping that. And I haven't had any breakouts lately, so I think I might have. I definitely, it was pears, and I'm thinking it might have been artificial sugar, Splenda. I've been using regular sugar instead of that, and that seemed to have made a difference. But so it's not bad. I'm not too worried about it, and I do take Benadryl when I need it.
Okay.
So thank you.
Pleasure. Let me just check in. I'm going to do a quick roll call and just make sure that we've got everybody. Jake Hannum, Jim Cameron, Lynn Sierra, Dennis Correa, Eric Bookbinder, Jim Harrington, Mike Tamales, Bill Franklin, Dan Louie, Tom Van Zandt, Peter Kafka, Larry Fish, and Bill Burhand. Anybody else? Okay. Len, you had a quick question.
Yes, it's a bizarre question, but I'm going to ask it. Since I've had prostate cancer, I sometimes will detect an unusual smell, something almost like a chemical burning or an electrical burning, and none of my family members, can smell that. So it has nothing to do with my house. So I was just wondering if anyone else has ever had that sensation. Some unusual smell, difficult to classify or categorize, but the best I can come up with is something like a chemical or electrical burning.
Is it anything like ozone, Len?
I don't know what ozone smells
like. You smell sometimes before a thunderstorm?
Oh, no, I don't think so.
I mean, because I've been smelling that myself the last couple of days, and there haven't been any thunderstorms. And I asked my wife, and she says, no, I don't smell anything. So I'm just,
Yeah.
I think it's ozone that you smell after a thunderstorm. I think that's the right thing.
That's correct. Yep.
Okay.
Okay, but I mean, it certainly isn't ozone in my case because, I can sense it through any season or indoors or outdoors or wherever.
Anybody else have any thoughts on this?
Another place that could be generating ozone is if you've got an electronic air cleaner in your air handling, air conditioning system or a heating system.
No, I do not.
No, neither do I.
It's interesting. I mean, the only thing that I can relate to this is that, and some of you will probably read this a couple of years ago, that there are dogs now being trained to smell out cancers, and prostate cancer is one of the ones where they've had a bunch of success. I have no idea what the smell is, whether it's the smell that Len's talking about or it isn't. Len, you might want to do a little bit of research online and find out about this this detection.
I've heard about that, Rick. It's something the dogs smell in the urine of prostate cancer patients.
Right. And I wonder if it's anything that's related, and you yourself may just be sensitive to it, and it could be. I don't know.
Yeah.
I mean, it's not out of the question.
Sorry?
I would say it's not out of the question, and there are certain people in this world who have been calling you a dog for many years, right, Len?
Well, I've been called a lot worse, yeah.
Oh, have you? Okay. Okay. But
I mean,
seriously,
this is Bill Burhans. I wonder, Len, if it's so I have not had that same experience of smelling something that's burning, but I do occasionally smell things that I don't think that the others around me smell, and it seems to correlate sometimes with different tastes if I'm eating things. So I wonder if it's just something going on with your olfactory receptors that's related to drugs that you're taking. I can't remember what drugs you might be on now.
Oh, well, right
But is that a
now
possibility?
I'm on drug holiday, and I still smell it, so I'm not sure.
Okay, well, that's so much for that theory.
Yeah, but I must say, I mentioned this to my sister, and she told me that her son, who had, I got a mental block on the, like epileptic seizures.
Okay.
He said that he complained of the same thing, the chemical or electrical burning smell. So who knows, maybe I'm having a stroke, I don't know.
Yeah,
God forbid.
It's strange.
God forbid.
Yeah, it's been, it's something that's been with me for well over a year. I don't know exactly when. And I just never even thought to ask anyone else until tonight.
Well, I'm glad that you asked, because if I'm, in the future, if I do have this sort of an experience, I'll be in touch with you.
Okay.
And guys, I mean, I really encourage all of you to, when you've got something like this going on, don't hold it back from your medical team, because, we're not the experts. They see a lot of people. They may have heard of it before. It may be something that's unusual, but they may be familiar with it, and they'll tell you in a heartbeat what's going on. So, there's no point. Don't live with something like this for a year and then suddenly mention it. I don't want you to blossom in a bad way or to flourish in a bad way, and then you've got to wrestle with that. So please just raise these issues with the medical team. It's important. Send them a note, when you see them. If you're not going to see them, if it's something like this, which has been going on for a while, put it on a list. Keep a running list of what you've got to talk to your doc about next time you see him, so you don't, the night before, think, oh, I meant to tell him about this, I meant to tell him about that. Just keep a note somewhere on your, on your email, a draft email or something. And if it's something more like what Jake's dealing with, don't hesitate to let your doctors know right away. You're not bothering them. That's what they're there for, and it's very, very important to keep them abreast. It's more important that you waste their time than they waste yours. And if you've got an issue going on, I mean, that's why, you're you call, I know whenever I call Kaiser, they always say, this is a medical emergency, call 911. Well, it's not a medical emergency, but it's important enough that it needs to be addressed. So, enough said. Anybody else want to talk to Len about this issue? Okay. Len, if you figure out what's going on, will you let us know?
Absolutely. I put it in my questions for my oncologist.
Good man. Good man. Let's move on. Eric, just give the guys a quick update on where your treatment's going.
Well, I've been on the experimental drug. I think at the other contract, and it's working so far. But they've started a new group here at UCSF, headed by Larry Fong, that's specifically dealing with immunotherapy, and they've agreed to see me. So next week I'm going to be going to see them. I had a Foundation 1 study done on my original tumor, which is now 3 years old. And at Rick Surging and other people, I had the liquid study done recently. And curiously enough, it came up with exactly the same things. So I guess I don't know if that's what difference it makes, but at any rate, I will be taking those studies with me when I go to see these guys, and they're going to see if there's any particular studies that I'd be eligible for right now, or at least get me in line. And so when this other drug quits working, I'll be set up for an immunotherapy. I hope to get in one right away, but we'll have to see. You know, they have lots of criteria. Rick knows criteria better than I do. But you know, sometimes you have to be failing all the drugs, and since I'm not failing a drug right now, I might not be eligible. So we'll see. But I'm seeing them day after tomorrow, and though that I had a bone scan and a CT, both of which showed that the cancer had not spread or grown any since I started this drug. I also have a weird new problem, which is that I'm getting radiating numbness in my neck, shoulders, and arms. And I didn't have a scan of my cervical spine when I had all the other scans, and so they're going to do a scan of the cervical spine because apparently that's related to C5, and they want to make sure that, you know, since my T1 is full of cancer, the likelihood of it spreading to C5 is pretty good. So I'll have that done on Thursday, and we'll see the results of that. So actually, it's not till a week from Thursday. But at any rate, I'm hoping that there's... Go ahead.
A couple of comments that I would like to make, and I also want to just throw it out so that people have questions for you or comments from their own perspective. First of all, the drug, we've talked about it several times, but the drug that Eric's been taking is just identified by its number, GS5829. It's a, is it Gilead? I always forget. Who's the manufacturer? Eric?
Yeah, the GS stands for Gilead.
Yeah, Gilead, yeah. So it's a Gilead drug that seems to swamp the androgen receptors, and it's worked for Eric. For how long, Eric? About 12 months you got out of it?
No, this is the 10th month.
10th month. Although now Eric's PSA is starting to creep up slowly, but it certainly has done some good work for him. the we wrote to Larry on Eric's behalf, and they have a possible specific trial with a drug I don't know much about, but maybe Bill or Len can do a little research and tell us. I haven't, unfortunately, since I got this, I haven't been in a place where I could really sit down and do the research that I wanted to do. But the trial is going to be for something called Aptevo. That's capital A, P is in Peter, T is in Tommy, E is in Edward, V is in Victor, O is in Oscar, Aptevo. And that's the trial they have in mind. We'll see where they go. And Eric will know better and tell us next week, and he'll let me know after on Wednesday. I'll be in the car for a lot of Wednesday, so we should be able to speak if you give me a buzz. I hope, Eric. So that's the second thing I wanted to mention about this. The third thing is, and this is just my own observation, doesn't have any medical credence at all, but it just seems to me that if they compared a biopsy of Eric's prostate from 2014 together with a liquid biopsy from 2017, and the two were exactly the same, it would seem to suggest that, and maybe Bill can comment on this, it would seem to suggest that Eric's tumor is not morphing, and this strange type of prostate cancer that Eric has that is aggressive and doesn't make PSA, and it's not small cell because they've looked at it. It's not neuroendocrine, but it just doesn't respond well to hormone drugs, so it doesn't seem to have a high commonality with adenocarcinomas. It hasn't changed much over those 3 years. And if I was a scientist, a medical scientist, I would find that quite remarkable. So, Bill, what's your take on this?
Hello?
Bill, what's your take on this? Hello?
I'm sorry, I had muted and I forgot to turn it off.
No
so,
problem.
So yeah, it is remarkable. I'm very surprised, Eric, that there weren't any changes. I think that's really unusual. It's much more frequently the case that there are quite a few changes. So I'm curious how many mutations were detected this time compared to last time, and were they exactly the same this time?
To tell you the truth, I have not gone over it with a fine-tooth comb. I was planning on doing that with the doctor, but they found that. I got my glasses on. Hold on here. The PIK3CA.
Okay.
And additional.
That's a gene in a growth signaling pathway, so that's not surprising.
Mm-hmm. No, they even tell me which trials are available for. It says trials available nearby, and then AR, which is maybe AR7, and then it says AMP, also trials nearby. BRAF.
Okay. That's another gene. Okay.
And then it says PIK3CA again. I'm not sure why it lists it twice.
There might be two mutations in that.
Okay, yeah. V329V.
Okay, that one I'm not familiar with.
It says synonymous mutations and variants of uncertain significance. The functional consequence and clinical significance of this gene variant are not established, similar to other alterations in circulating cfDNA. The amount of this variant may reflect disease progression or response to treatment, chemical correlation.
That's me. Sorry, guys. I'm trying to silence myself here.
Okay, and then the last one is ERBB2, which it also says there's nothing. So those last three, it says that there's no functional significance. There's only the two
Right.
that have treatments available.
Right. So the ones that they're designated as variants of unknown significance could be relevant, that could be contributing to the pathology of your disease. But at this point, there's no evidence from other patients. So that's why that's basically why they give it that designation. But the other ones, most of the other ones that you indicated, I recognize as genes that are involved in, important growth signaling pathways that you would expect if they were mutated would, contribute to cancer. How different is that list?
Well, now that I look at this more carefully, there are differences between the two of them. The first one did just show the PIK3A, and it said P10 loss. So the other ones mentioned here did not show up in the first one.
So just tell me again, what are the new ones that are showing up? BRAF was one, and what are the other ones?
Yeah, just says AR.
That might be androgen receptor. I'm not sure.
Yeah. It looks like it because of the drugs to treat it, which are insulinamide, abiraterone, etc.
Sure. Okay. Yep. Okay, so anyway. I mean, there should be some overlap because mutations that existed 3 years ago are not going to go away. And so you should have, you should see those showing up again. I shouldn't say that it's possible that they might go away, but highly unlikely. But then, so what would be interesting is to know what new ones have, what new mutations have arisen.
Right. Well, so they say they identified 6 somatic alterations as opposed to before they only identified 2.
Okay, so that is then not that surprising. I mean, that reflects the general plasticity of the genomes of tumor cells. You're picking up quite a few more mutations over that time period, and that's what happens in cancer. So that's not,
that makes more sense.
Oh, by the way, Rick, you were wondering who did the analysis, and it's some Gardent. Gardent 360. Analysis.
Yeah. Okay, it's a Gardent analysis. Okay, so let me just recap because I'd like to just keep a note of it. So the new mutations that you have are BRAF, AR, and what are the other 2?
Another PIK3CA and ERBB2, parentheses HER2.
Oh, HER2.
Yeah, that's a big
interesting. That's a big one.
Yeah. Yep.
So I think that one of the things that you need to do when you speak to Gabe, what's his last name, the guy you're going to see?
Right. Yeah. I forget. Anyway.
Okay. When you go in to see this new guy, I'm just looking here. I know I've got it. Gabe Mannis, MANNIS.
Right.
You need to ask him. Never mind his new trial. You need to ask him about Herceptin. HERCEPTIN. Because Herceptin is a drug that addresses HCR2. I don't know, Bill's going to tell us in a minute exactly what a mutation in HCR2 means, but I know, for example, I have a friend with advanced lung cancer who had HCR2 mutation, and he got 12 months out of Herceptin before it failed on him.
Right.
So,
Herceptin was one of the early drugs that were turned out to be effective in targeted therapy approaches. So it's been around for a little bit longer than many of the other drugs, and it's I think it's widely used in other types of cancer, especially breast cancer.
Right.
The original mutation, from what I remember, back when I was spending more time in the lab, is a translocation of two, pieces of chromosomes that leads to the activation of a gene that normally wouldn't be activated. But in any case, Rick is absolutely right. There's a good chance that Herceptin would be active against this mutation. So I would very definitely raise, that issue with your oncologist.
Now, the other thing I would suggest you do is, you haven't shared a copy of this with Agarwal yet, have you? With Raul Agarwal, correct?
Correct.
I would email that to Agarwal immediately, because here's the thing. It's all well and good them saying, okay, we're going to put you into the new immunotherapy clinic and we're going to try you on these new drugs and da. But if they see a mutation where there's an available drug that's proven, it seems to me it makes more sense to go with what we know works than test you on put you into a trial where we don't know if anything works or not. And so it may be that they'll see this HCR2 and they'll say, wow, or Manis will see the HCR2 and they'll say, let's go with the HCR2. The problem is you don't want to slip between the cracks, because it's not really clear who your lead person is, whether it's going to be Gabe Manis going forward, and what happens if there's a drug that's available which isn't exactly an immunotherapy drug, because, correct me if I'm wrong, Bill, but I don't think that HCR2 is an immunotherapy drug. It is a precision medicine drug, but it isn't something that works on through the immune system. Is that right?
I do believe it is, yeah.
So, the question is, whose court is that in? And then Agarwal, of course, has been a trial guy, so you've been seeing him. And the last thing you want to do is go back to Amy Lynn. Under no circumstances would I recommend that. So, you're going to have to find who's going to be your quarterback. It's all positive. I mean, I'm not trying to. I'm not raising this to give you concern, Eric. It's really positive. It's great that we see something that's in the HCR2 pathway, because it may mean that you're going to respond to Herceptin. Right. But you're going to have to. I mean, I would send a note to Agarwal tonight saying, you are on the call tonight, and there are some experienced people on there, and including Bill, etc. And we went through this, and you've got a mutation in the HCR2 pathway, whatever it's called, ERBL in the HCR2 pathway. And is this something that's really? Should this be raised with Gabe? Should it be raised with him? And does it affect going forward, and let him know? And in any event, you're probably going to finish up going there on Wednesday anyway, but I just don't want to see you get hijacked into a trial because you think that's the only thing that's available to you now, when there may be other things that are available to you.
Okay. Yeah.
Okay.
Important. Yes.
So good luck with it, Eric. I'll be interested to know what you learn at your next meeting with your oncologist.
Okay. I will fill everyone in.
Okay.
Good. Okay. It's good news. It's good news. All right, we're moving along here. Jim Harrington, what's up?
Yeah, Rick. Yeah, I'm on a trial, and I've explained this trial before, but very simply put, it's a combination of pembrolizumab, which is Keytruda, that's made by Merck, and you can see it advertised on TV for use in certain lung cancers and melanoma and skin cancers. Anyway, I've had 3 infusions, and it takes a little while to get used to these things, but I'm doing much better with them. You get a little fatigue. As my med-onc said, you feel a little crappy for the day after. That's probably true. And Listeria can make you tired. And I always have the chills, and I have the shakes, and I get the drug Demerol to stop that. But let me just get to the results. Every time, in a trial, of course, as Rick says, and they're highly structured. I mean, everything has to be just right. And in fact, I was anemic the last time, so that I had 2 units of blood to bring my hemoglobin up to 9 plus, so I could have the infusion. Anyway, that's over. Don't know why I was anemic, but the blood sure works. Anyway, the good news out of this trial, I've had 3 infusions, and is that my PSA has gone down. In fact, it started out at 2.5, and as Rick has mentioned on past occasions, I'm one of those that doesn't make a lot of PSA. So it started out at 2.5, and this last week, it was 1.37. So I'm really encouraged, and my doctor, Dr. Stein, Mark Stein at the Cancer Institute in New Jersey, where this is being done, is just downright ebullient. He's just, he's just beaming with that someone this is happening to. But, you know, so at the moment it's good news. My PSA is going down. I've got 2 years of this, so if this trial goes on, and yeah.
Jim, just give us the 2.5, and when was that?
That was the beginning. That was the first day, the first infusion.
When was that?
It was 9 weeks ago. So it was March. It was 9 weeks ago. I know you take good notes, and this was last week on actually a couple of days ago when it was 1.37. It just continues to keep going down.
Okay. So hold on a second, because I do want to make a note of this. So 9 weeks ago you started, so that would have been the end of February.
Yeah, it was actually in March, I think, because yes, I mean it's every 3 weeks, so it's 3 plus 3 plus 3, so it's 9. Yes, I've had 9 weeks of this stuff, and that's right. End of February, beginning of March, something like that. Let's see, I guess that's right. Yeah.
Okay, and what was the middle one? 2.5?
No, I went down to 2.5. It went down to, geez, that's a good question. 2.2 maybe. It really started to go down this last time. It really started. It really took a dive. And I noticed this may not sound like much, but
from the other Listeria, because I remember you telling me that they put the whole trial on hold.
Yeah, I heard you did tell me that, Rick, but I checked on that, and Dr. Stein and the phase 1 team, it's a team, it's a phase 1 study, they say they're still recruiting. Okay. I guess there'll be about 15 at the Cancer Institute in New Jersey when the smoke clears. But they're still recruiting. They don't say anything about what the email you sent me with respect to Johns Hopkins. Johns Hopkins is not one of the schools, one of the centers, but don't know.
Okay, that was feedback that we got from
I remember.
Silverio and
that's right.
LaHaye when Ron went in for his appointment. So I don't know what's going on there.
No, I don't know. As far as I know, they're still recruiting up to a certain number, but that would be at each center, maybe about 15. There's 8 centers. But, I mean, you know, pembrolizumab is a very interesting drug. By the way, just for those on the call that want to get, if you're all sitting down for this one, I asked, what's it cost? Now, I don't pay for anything. Not on these trials. I don't pay for CT. I don't pay for bone scans. Obviously, don't pay for the drugs. But the pembrolizumab is about $20,000 per time. Well, so someday Merck's going to probably make a lot of money. I don't know.
It's actually, I mean, I know what it costs because when Trevor passed,
Oh.
God rest his soul. We actually had to get one infusion for him. This was last June.
Oh, okay. Really expensive.
And we paid out of pocket. Vet paid just over $8,000 to UCSF, although they later reimbursed her. So, but it is an expensive drug.
Yeah, I mean, these drugs are mixed there in their pharmacy, and then they're brought to me, and the Listeria as well. Listeria is, it makes you tired. When they put you in a bed, the whole process takes 11 hours or 12 because you have to sit there for 4 hours. It's after the Listeria is over, and that's 2 hours of putting through. And they mean it to the minute. You guys said, come on, my blood pressure's back down. I want to go home. No dice. You have to follow exactly the rules of the trial.
Okay,
but it's okay.
So again, in the interest that we've still got 4 or 5 guys to cover here, we've got quite a lot going on.
No, that's
today.
all I have to say, Rick. Thanks for the time.
Anybody want to? I just want to throw it open so this just isn't a conversation between the two of us. Anybody else like to talk to Jim about this Listeria trial?
I just want to say congratulations on the seeming success of it so far.
Yeah, thank you very much. It's a good sign. I mean, if this would work as an immunotherapy, that pembrolizumab, it could, as they say, it could put my cancer in remission, and those are good things. I mean, 2 years of this, it's a lot, but yeah, no, they don't know. There's no evidence that this is going to work. I want to be sure to point that out. But pembrolizumab is tried in a lot of cancers, given to some 50,000 patients, most research. So.
Okay.
That's all.
It sounds really promising to me, Jim. This is Bill Burns.
Bill,
yeah.
Sorry, Bill.
Yeah, Bill.
I'm going to be keeping your experience in mind going forward. Once the drug that I'm taking stops working, this sounds like it might be a viable alternative.
Yeah, I think so, Bill. I talked to Rick because we had dinner when I was out in San Francisco. I guess I'm going to have to go to Tucson to have dinners with him now. But I think that I was at a crossroads. Go the chemo route or go into this trial.
Right.
And they put me at the top of the list to go into trial. I did it. I chose this path because I think there's no downside. And but so far, I'm pleased. If it doesn't work, I'll have chemo. But it does seem to be a very interesting alternative. So we'll see.
Yeah. Well, good luck with it. I hope it continues.
Yeah, thanks a lot. I mean, the pembrolizumab, by the way, that's the 4th infusion. It's just that one, no Listeria. Is well tolerated. I don't feel anything from that.
Great.
Good. Which is good because that isn't the case with everybody. But I would love to talk more, but we do need to move this along.
Oh, sure. Go ahead, Rick. Thank you for the time.
Really good. We're hearing some really good things today. Mike Tamales and Peter Kafka, do you want to give us a quick update on Mike's situation? Fairly terse, if you can, please.
No, I don't know where to
Go ahead,
start.
Mike.
Well, I got the neuropathy in both legs, so he took me off the Xtandi to see if that had anything to do with it, and a little bit went away, but I still have it. I still have it in both legs. They did a MRI on my thoracic spine, and they they found like a disc protrusion, and on my let's see, on my lumbar spine, they found some disc protrusion, and basically said not to do any heavy lifting anymore. he took me off the Xtandi to see if that was going to help. It helped a little bit, but it also shot my PSA from 132 up to 182. So
what's the time frame there, Mike? Between over how long the period?
That's about a month.
Okay.
And so he's putting me back on Xtandi, and he a neuropathy, and neither was the pharmacist with it. And I'm telling him that people say that there is, but I guess that's the only course of action right now is to take the Xtandi and see if it drops the PSA.
Well, the neuropathy is associated with hormones, with LHRH drugs. That's the Lupron. So if you've been on Lupron for a long time, they should be aware that neuropathy is a side effect of the Lupron. I don't know that it's a side effect of the enzalutamide. That works differently. But it is a side effect of long-term Lupron, definitely. And they could research that. They can find it.
Oh, that probably could be it, because I've been taking Lupron for quite a while now.
Yeah, I mean, it is, and I think I've got some notes on it somewhere once I have a good internet connection again, but I've discussed it we've discussed it on this in these groups before, and I've discussed it with some Geneva urinary medical oncologists, and they all acknowledge that yes, it's a known problem, not that common. I have mild neuropathy left over from the LHRH, and many of us do. And the problem, of course, is that some of the guys are on LHRH and chemotherapy. We know that the chemo causes neuropathy. It's hard to isolate what exactly it is, but yes, I think that probably the neuropathy is a bit of a problem. Where are you in terms of them trying to sequence you? Are they going to do a blood biopsy? What are they going to do to find out if you've got any mutations?
I don't know.
Well, but why don't you know? Did you ask him?
No.
Mike, we can really help you, and we try to, but you've got to help yourself. I mean, we've been talking about, you just heard what with Eric. Eric just got a blood biopsy, and it came back, and he has a variant in the pathway where there's a known drug that works on that pathway. How are we going to get you genomically tested? We sound like a broken record on this subject because we always come back to the same thing. How are we going to do it?
Rick, he did have a liquid biopsy last year that showed nothing. It didn't show any mutations. So right now we're trying to get him back on the Xtandi because he hasn't really given it a try yet. He tried it for 3 weeks, and then he's been off now for about 7 or 8 weeks. So yes, we could do it. We'll talk to him about trying to get him on something else. But the doctor was more concerned this time about making sure that he didn't have any kind of pressure on the spinal cord from the meds. I asked him if there was no increase.
I agree with you, Peter. I agree with you. And, it's hard. I don't want to second guess you because you do such a great job with him. But I don't understand. We know that these cancers change. We know they do. And I'm doing a 180-degree turnaround now because I understood from Eric that his cancer hadn't changed in the 3-year period, but when Eric looked at his report a little more carefully, we found it had changed and there were some variants. Now, this cancer changes quickly and it moves. And just because he had a blood biopsy a year ago doesn't mean he shouldn't have a blood biopsy today. And it also doesn't mean that he can't do something else if it's one of these more advanced drugs at the same time.
Okay,
and when your PSA goes from 132 to 182 in a month, and I understand that he's not doing any enzalutamide, so that's probably a good reason. If we can get it paid for and it's not out of pocket, if it were me personally, and this was my PSA, I would be wanting to know, has anything changed? I would really like to get, even though we had this discussion and I stand corrected because most of the variations are in the blood, in the liquid biopsy. I now understand that, having spoken to the people at Foundation Medicine. We need to know if there are any new mutations that we can be working on. There's no downside.
Okay, we will get on it. We'll make it priority number 1 with the next appointment.
I mean, it seems to me, and again, I mean, I'm not a doc, but from what I'm hearing, is that maybe a lot of these issues with the neuropathy and the back pain that Mike's been wrestling with for so long may not be cancer related. I mean, we don't know for sure because the cancer can be causing issues, but if he's got a bulging disc, it may be that's what Jim Cameron, that's what Jim Cameron had taken care of on Friday. So it's easy to put everything down to the cancer, but sometimes, fortunately, it isn't the cancer. And if it isn't the cancer, then other docs should be involved. I mean, I'm sure that now that we know that Mike has a bulging disc, how is that going to get treated?
I didn't read it as a bulging disc. When I read the report, it said it was a very thin to non-existent disc when I read it. That there was one section of the spine there where there was very little material. I didn't see a bulging one. But I'll read his report again.
Mike Tamales just described it as a disc protrusion.
I will read it again. Maybe I missed it.
Let's see. There's disc generation, disc protrusion,
Okay. So the point is that a disc protrusion is a bulging disc, and so we need Mike, you need to find a doctor. Again, you've got to be proactive. Don't necessarily. Peter, God bless him, is doing all this for you, but you've got to do some stuff for yourself, man. You got a bulging disc. What are you going to do about it? Are you there?
Yeah, I'm here.
What are you going to do about your bulging disc?
I have no idea. Huh?
Are you going to suffer with it?
I don't know what to do with it.
Well, how about talking to a doctor about it? I mean, Mike, if you've got something wrong, you've got to talk to the doctor, right?
Yeah.
So, who was it that did these scans for you? Was it the medical oncologist, or was it somebody else?
It did the what?
Who did the scans? Who ordered these scans for you?
The oncologist.
Okay, so have you asked the oncologist to send these scans to your general practitioner?
No.
Do you think that would be a good idea?
Yeah, I see him on Wednesday.
You see who?
My GP.
Have you told your GP that you have disc protrusions?
No, I go see him on Wednesday.
Okay, what about trying to get those scans to him before Wednesday when you go see him so you can talk to him about what to do about them?
Yeah, I guess I could do that, yeah.
Look, I'm sorry if I sound frustrated. I think everybody on this call is frustrated. There's only so much we can do for you. You've got to think to yourself, man. We're trying to do the very best we can to keep you around and to make your life easier. But the medical oncologist is not the guy that treats a bulging disc, for goodness sake. I don't know who it is. I don't know what sort of doctor you want to see for the bulging disc, some sort of an orthopedic doctor, I suspect. But whoever it is, you've got to get a referral. And that referral has to come from your GP, most likely. Now, this is not brain surgery. It ain't rocket science. So tomorrow, please call the surgeon, please call the medical oncologist office and make sure they send these, it's digital, so they can send them over to your GP. When you go in to see your GP on Wednesday, you say, Doc, I got bulging discs on top of everything else. How are we going to get it treated? Because if we eliminate other symptoms for you, Mike, then we know what the cancer is doing. We don't know whether it's the cancer that's causing you pain or whether it's something else that's causing you pain and making you feel wrong right now. And neuropathy may not be neuropathy at all. It may be numbness because you've got degenerated spine. So we shouldn't even be talking about neuropathy with the doctor. Do you see where I'm going with this?
Yeah, I don't know who to go to. I'm lost. I'm confused. I'm lost.
I hear you, Mike, and we're trying to help you. But you know that if you've got a problem, a medical problem, you talk to a doctor. You know that, right?
Yeah.
And if you don't know which doctor to talk to, you know you have to talk to your general practitioner, right?
Yeah.
So when you say to me you don't know who to talk to, it sounds to me like you don't want to talk to anybody about it. You'd rather suffer. If that's what you want, that's fine. But tell us that that's what you want. Tell us you don't want to deal with it, and we'll leave you alone. But don't tell us that you've got neuropathy when it may not be neuropathy. It may be the nerve damage and numbness that's from your spine, and you need to address that.
Well, that's...
All right. I mean, unfortunately, we've got you know, we've only got 20 minutes, and we've got a couple of guys we've got to talk to. But I mean, I'm happy to talk to you about your cancer, but we've got to eliminate the things we can eliminate. And it may well be that this neuropathy can be eliminated by treating your back, and then you're going to have feeling again. And what you think is neuropathy is nerve damage from your spinal issues. We've got to try and track that down, and then we can start talking about, you know, you stopped the enzalutamide because you thought you had neuropathy. That might have been a silly thing to do. Look what it did to your PSA.
Well, that's what I was told to do.
But you were told to do it because the doctor didn't have all the information. Now you have the information. Yeah. You have to take some responsibility here too, Mike. You know, I have to say it. It's not you were told to do this, you were told to do that. You have to take some responsibility. If you want to get better and you want to stick around in this world, you've got to do some stuff for yourself. You have to. Because Peter is running around, we're all concerned, we're all trying to get you the best treatment, and if you're just sitting there saying, well, you know, if it happens, and I don't know what to talk to, we don't know what to do for you, and we care about you. All right, I'll get off the call. Before we leave, is there anybody that wants to add anything? Okay.
No, I'll just go drop off tomorrow.
It's Larry Fish. Mike, come on, man. Mike, we don't want to lose you if we can do something about it. Come on, it's simple. Just put one foot in front of the other. Make a list. It's no downside, as Rick is saying. Come on, man. You're making me sad.
Thank you.
Thank you, Larry. Oh, okay. The oncologist is supposed to be leading this thing, and I'm just going by what he says. Yeah.
The oncologist is, Mike, the oncologist is leading your cancer treatment. If you break your arm, should the oncologist fix your arm?
No.
No. So if you have a bad back and you have bulging discs, and God help us, there are enough people who have that, and we just heard about a guy that suffered with this for 10 years and had surgery on Friday for it. He didn't have surgery from his oncologist. So, you know, as Larry says, make a list, do something. Call your doc, call your general practitioner and say, I got a problem, doc. I've got bulging discs. I'm sending you over the pictures. Because what can happen? You're going to go in and tell him on Wednesday, he's going to say, well, come back in a week after I've looked at the pictures. You want to wait another week before you start dealing with these bulging discs, or do you want to get rid of your neuropathy? What do you want?
I want to do the right thing. I'm not sure what the right thing is. So, see, does he want the copy of the report, or does he want the pictures also?
He wants everything that you can give him that will help inform him. Anything you've got, give it to him.
Okay.
Okay?
Okay. Gotcha.
Okay.
I'll be there tomorrow. Thank you.
Thanks. Thank you. Okay, Bill Franklin, you have a question, I think you said.
Can you hear me?
We can hear you.
Okay. Yeah, so I've been suffering from a lot of fatigue lately, and it seems to, I was interested in listening to the hyperbaric treatment that Jim was talking about. So I had really bad radiation proctitis when I had my radiation treatment.
Right.
And it cleared up. When was it? I think it was like January. I actually had a see, now I got brain fog, I think. I had a colonoscopy in January, and
right.
And he was aware of my radiation treatment and everything, and he said he could see the area where the proctitis affected me. And he said it looked okay, but I've had recurrences since then several times, and my fatigue seems to coincide whenever I have the proctitis symptoms, I get the fatigue. So I'm wondering if is my intestinal tract working? Is it extracting the nutrients it needs from my food, or is the proctitis causing, you know, that to malfunction and cause my fatigue? So
let me ask you a question, Bill. Are you losing a lot of blood with your radiation proctitis or not?
not a lot. It's occasionally there is blood in my stool, but it's
right.
not every time,
right.
and it's not a lot. No.
Right. Sadly, I'm intimately familiar with this problem because I have the same problem. I don't bleed badly, but I bleed. So, you know, it never bothers me. I don't get scared or worried about it. I know exactly where it is. I've even seen it when they've done some of these exams. They've pointed out where the irritation is on the wall. So, the only thing that I was thinking is if there was some other damage, you know, my doc said to me way back when, this must have been 8 years ago, that he didn't want me to have a colonoscopy for at least 4 or 5 years because he was worried that it could cause a fistula, which would give me even more aggravation. Because when the wall of the rectum is weak, they have to be very careful. And so I'm always
talking about that.
Right.
I waited 6 months after radiation to have the colonoscopy. So,
believe it or not, I waited 10 years. In the end, I did endoscopy, and then this year they did do a colonoscopy. But it is an issue, and I'm glad that you're aware of it and that your doctors are aware of it. My suggestion: have you ever had a consult with a GI doc?
Yeah, the GI doc's the one that did the colonoscopy. He's the one I met with prior to it. So.
Okay, and what has he said about treating the radiation proctitis?
Well, like I said, he's the one that did the colonoscopy, and he said it looked okay. That was his. I think that was his exact words, right? So, and I had the recurrence after that. So
they don't think that you need to. They don't think that you need to have any laser treatment to seal off the veins or anything like that.
He has mentioned it, but he said it's something we can look at later if it's really bad, irritating to me. Gave me some suppositories to treat it, Canassa suppositories, when it flares up. But I keep a log. I keep a daily log of every medication I take, how I feel that day, if I have a flare up of anything, how many times I get up in the middle of the night, go to the bathroom, and how I feel. And I can go back to my daily log and see I had a lot of fatigue. I had proctitis this day. I had a lot of fatigue. So it seems to me that there's a connection.
Have you talked to the GI doc about that connection?
Yeah, he doesn't seem to think that he thinks that fatigue is Lupron. So.
Well, you know what? How long have you been on the Lupron now?
17 months, 16 months, yeah.
It's going to start hitting you around now pretty bad. I mean, everybody on this call, or most everybody's going to tell you that. I certainly can tell you that from my own experience. 17, 18 months out. The issue is it shouldn't be tied into the radiation proctitis. I mean, mine was not. It was every day. It wasn't some days. Some days were better than others, but there was no significant change when I had any bleeding.
Okay.
So, again, let's throw it open to see if any other guys, if we can brainstorm it. Anybody got any ideas for Bill on this one?
Yeah, this is Dennis. I got a couple of things I just started doing for my fatigue and Lupron-related issues. And this is with the complementary care doctor at the University of Arizona Cancer Center where I go for my treatment. She has recommended a product called Zyflamend Whole Body. It's a herbal approach to pain relief and formulated specifically for whole body healthy inflammation response.
Can you spell it for us, please? Can you spell it for us, please, Dennis?
Okay, it's Z-Y-F-L-A-M-E-N-D.
Zyflamend.
Zyflamend, yeah.
Okay.
And there's been some trials on this stuff. This is an over-the-counter supplement, so I'm giving it a try. And that, along with massage therapy, which I had my first massage today and felt terrific after. Now, I realize that's kind of short-lived, but I'm going to try it where I go back and get it periodically and see how that, if that helps.
Well, I always feel good after massage, I guess.
Again, I just want to remind everybody, notwithstanding that a very reputable doctor recommends Zyflamend to Dennis Correa, if you add a supplement of any sort, just run it past your medical team. Make sure they know you're taking it. You can tell them that it's been recommended by palliative care docs at Centers of Excellence. That's fine, but just make sure they know. It's important that we, that when we have this advanced disease, we just don't take supplements willy-nilly, because sometimes there can be bad reactions. So I just encourage you all to run this past your docs. What is in the Zyflamend?
I had a comment to make for Bill about the fatigue problem, and that is sort of a question first. What are you doing in terms of exercise, Bill, on a daily basis?
Who is it that's speaking? Who is that was just speaking?
Tom 711.
Sorry, who was it speaking?
Tom 711.
Oh, Tom 711. Hi, Tom. Welcome.
I'm new. But
okay.
I'll just make the comment. I'm 81 going on 82, and I'm still mobile enough that I can get out and take a walk. And a long time ago, I found that it's very helpful for me anyway to, when I feel tired, get up like I don't feel tired and get out and take a walk around the block as far as I can. Back to the earlier comment about the gentleman that has neuropathy. I have horrible neuropathy, and so walking is a very difficult thing for me, but nonetheless, I get out and I walk as much as I can and stop as I have to, and in the end, when I return from the walk, it's a little bit like the massage. I feel better having taken a walk. I am not as fatigued after I've taken the walk, and it lasts for a while. So you might try that as a possible remedy to the fatigue, is even though you feel like not getting out of the chair, sometimes getting out of the chair is the answer to the fatigue. Get out and take a walk or do something. Do some exercise. Do you have an exercise cycle or something like that, Bill?
Right.
I exercise regularly.
Right. He does, but I just want to say, I just would like to thank Tom for that, and I want to issue a disclaimer that I did not write that script for him. And it just warms the cockles of my heart to hear somebody we don't even know. It's a new man we don't know anything really about. Tom, I'm sorry that we haven't given you any time today, Tom. We will definitely next time. But there are people on this call who will tell you that they've heard that from me like a broken record.
Yes.
And it works.
Yes. And it's when you feel the most tired is when you most have to get
up.
Works
the best. Exactly.
Right.
Exactly. Boy, we like you. Come back.
I'll be back. This is a starter. I promise my son, my 60-year-old son, is coaching me a little bit on how to use a support group to help me with my problems. And he said, you make sure you talk. I told him this was going to be my first event of any type where I was talking to other people with cancer. And I said, I promise I'll talk and try to join in the conversation. And fortunately, I guess I need help. My son thinks I need a lot of help. I'm pestering him all the time. He says, talk to people that can help you. Don't talk to me. So here I am. And I'll come back.
Well, you know, we're almost through now, but we will give you plenty of time to tell us about yourself. But I want to tell you what you just told Bill, not necessarily for Bill, because I know Bill is an avid exerciser, but what you just said to Bill is a fantastic testament to what we've been preaching on these Reluctant Brotherhood calls and on the anti-cancer calls for the last 7 or 8 years.
Oh, good.
It is this exercise is so important. And just as Tom says, at the time when you least feel like doing it, you've got to force yourself out, you've got to do it, and you're going to feel most of the time 100% better when you come back.
Right.
I don't know why, but that's how it works.
It is.
Bill, I want to just go back and just wrap up with you. I just think that, you know, you've got to keep, you just got to stick on it with your GI docs. I do wonder if it isn't the excuse me, I do wonder if it isn't the underlying Lupron, because it's you know, you're right in the sweet spot where it starts to, at least for me. And the thing is, you know, how old are you now, Bill?
53. I'll be, 53.
Yeah, I was a little bit older. I was about 57 when I was a year and a half out, 67, 58. You know, the younger guys, I think it does hit harder than the older guys. And I have a lot of empathy for you, and a lot of sympathy too, but I just think that, I mean, it's terrific what you're doing. The way you're keeping your records is phenomenal, and it's going to prove to be very helpful. But I do wonder whether it might not be the Lupron, and I don't know how the Zyflamen work. Dennis, do you know what's in the Zyflamen?
Yes, let me get stuff here. Let's see. Oh, in addition to the stuff like turmeric, ginger, green tea, holy basil. Let's see. There's some Chinese gold thread, Hu Zhang, Chinese skullcap, barberry. Let's see, rosemary, oregano. I guess about 10 herbs. I think I got them all.
Okay.
Can I make just? I'll make a quick comment on Zyflamen, which is a product that was developed by New Chapter, but bought out by Procter & Gamble, and so it's a product that is now sold by Procter & Gamble as their first entry into cancer treatments and supplements and so forth and so on, which is kind of interesting. Wow. And I just bought some myself, which I'm trying to see whether I'm allergic to it in any way by just taking a modest amount instead of the 1 capsule a day. Zyflamen has a lot of promise, and a lot of doctors are recommending it for cancer treatment.
Yes, that's what she said. There are some small trials have been done on it, and it shows it to be somewhat effective there. But my dosage is supposed to be 2 capsules a day, but I got to start with 1 capsule. Because again, the first time I had it, I took it that evening. I had a little bit of gastric indigestion, kind of like I just went out and ate a big spicy Italian meatball or something. But then since then, I've taken about 2 or 3 other times now, and it's I don't seem to have that problem. So I got to do one capsule for about 2 weeks, and then go to 2, and it takes about 20 days before you should start to feel the effects.
Well, again, you know, guys, just do review, because there are a couple of those ingredients I'm not 100% sure about, I mean, obviously the turmeric, the ginger, the oregano, all of that is great. And we know how good some of those products are in the context of stimulating your immune system and controlling inflammation. But I just, again, want to say, just be sure that your doctor knows what you're doing and they're aware. Because as long as there's nothing that's going to hurt you, any good doc is going to say, try it. It's like chicken soup. It can't hurt you, and it may help you. So
this is Bill Burhans. There is the Memorial Sloan Kettering has a website that is labeled something like integrative medicine, in which they discuss a number of herbal drugs like this one, and including this one. And their description of this drug indicates that it's been fairly well studied, in cancer research laboratories, and actually does show quite a bit of activity, anti-cancer activity. So, it sounds like it's probably a good idea to take this, but as Rick said, I think it's really important that your oncologists know that you're taking it because of the potential for interactions with other drugs.
Right.
But anyone looking for information about herbal drugs, this website is actually really useful. They have a detailed description of many different drugs, and you get a pretty good idea of whether or not they're worthwhile or not.
It is a great website, and we'll come back to it. I just need to touch base with three guys who haven't had a chance to speak because, as you hear, we've had a hell of a lot to. Thank goodness Tom 711 didn't come on at the beginning, otherwise we would have really missed a lot of guys tonight. So, Dan Louie, I know you haven't been with us for a while. I don't want to cut you short. Do you think you can make the meeting next Tuesday?
Yeah, I think I can.
I'm really sorry. It's just, you can hear, we've just had a heck of a lot today, and my sincere apologies to you, and we really want to catch up with you. I'm just really glad to hear your voice, to be honest. So that's fantastic. Peter, I'm sure that, did you say you had a quick question for Jim Harrington? Was that you?
No, for Dan Louie.
Oh, for Dan Louie.
Okay, go ahead.
Dan, was it you that drove Bob Huffmaster down to a meeting down in Silicon Valley?
View? Yes, that was me.
Yeah, are you still in touch with him?
I haven't seen him for a few months. I'm concerned about him because he was a very energetic guy.
I had lunch with him when I was in the Bay Area a month and a half ago, mid March.
Okay.
Yeah, I'll get your email from Rick, and then I'll let you know what's up with him.
Okay, sounds good. I appreciate it. Yeah, we were concerned, haven't heard, and we've been looking for him at the Tuesday meetings, and nothing. So.
Yeah, we need to light a fire under him. I know. Okay, I'll get your email from Rick.
Sounds good.
Okay. And Bill, I'd love for you to give us a update. And are you recovering okay? No side effects from the surgery?
Just very quickly, Rick. No, I'm pain-free for the first time in a couple of years.
Oh, fantastic!
Congratulations.
It's not.
That's great to hear.
So just very quickly, 2 Fridays ago, I had a intrathecal pain pump installed that's delivering narcotics into the intrathecal space of my spine. And this is to address a chronic pain problem that I've had related to radiation damage. So it's not really a problem.
I'm going to interrupt you. I'm going to interrupt you because I don't want you to do it quickly. I really would like to spend some time on this.
Okay.
And because I think it's going to be interesting to a lot of guys, and I don't want to rush through it. And we just didn't have time tonight. And what I really wanted to hear is what you told us, is that you're pain-free and you don't have any complications from the surgery. That's what I selfishly, that's what I wanted to hear.
Yep, that's the take-home message.
Okay, and definitely, next time we're on, we'll boost you up as we will with Dan Louis, and make sure that we get to talk about this procedure, because it's a procedure that I think is important for a lot of guys.
Yeah, I think there's a lot of information. It would be well worthwhile. I think there's a lot of information I could give to others on this call that would be useful.
Yeah, definitely. So again, I'm sorry that we didn't manage to call a little better. I'm sorry I didn't manage to call a little better.
Don't apologize. Not a problem.
The next call will be Tuesday. Tuesday I'll have internet connection. Tuesday I'll be staying at my buddies in Mill Valley, and I'll have good internet connection next Tuesday. So hopefully that'll be fine. Just a quick reminder, we have a caregivers call tomorrow at 3 o'clock. No, hold on a minute. Tomorrow's the first, 4 o'clock. East, 4 o'clock Pacific time, we have a caregivers call. So any of you that have caregivers that would like to join this call, they are exceptionally welcome. Or if you know any caregivers for people with advanced cancer, any sort of cancer, they are very welcome. They join the same way as you join this call. We look forward to talking to them in the caregivers call. And do we have an inner conversations call? No, we don't. Do we, Jake? Do we have an inner conversations call this week?
No, second and fourth Thursday.
Okay.
Next Thursday.
So again, we'll be talking to you all, and this was, gosh, we got a lot of great information in this call. Good night from Southern Arizona. Peter, I'll give you a call, and Jake, I'll give you a call afterwards.
Okay.
Okay.
What time zone are you in?
Arizona's in the summer. Arizona doesn't change its clocks. So the summer it's Pacific, the winter it is Mountain.
Okay.
Okay, just like Hawaii. Okay. All right. Bye, guys.
Okay,
Bye-bye.
thank you, Rick.
Good night.
Good night.
Good night.